Welcome to the Veterinary Marketing Podcast, where it's all about helping your veterinary practice attract, engage, and retain clients. Broadcasting a new podcast every Monday from sunny Southern California, here's your host, Brandon Bashirs.
Hey there, everybody. Welcome to episode number 217 of the Veterinary Marketing Podcast. On today's episode, we have a very special guest. We have Dr. Brett Beckman, and I'm very excited. We're talking all about dentistry, dental marketing, how to differentiate yourself. It's going to be a really, really good episode, and I'm very excited for it. Before we begin, I would like to mention just a couple of things. First, if you haven't done so already, be sure to subscribe on iTunes, Google Play, Spotify, wherever you get your podcasts from. And if you are looking for help with your marketing at all, the best place to go there is the Veterinary Marketing Nerds Facebook group. If you go to facebook.com/groups/the Veterinary Marketing Nerds, you'll be able to request to join there. And if you're looking for help, you have questions, you are trying to get some ideas, it just is filled with over 2,100 veterinary professionals now who are also looking to market their practices. So it's a really good place to go get help or collaboration or just all kinds of things. It's completely free as well. So I'd also like to mention this episode is being sponsored by two websites by Brad Haven. We have usedvetequipment.com and newvetequipment.com. For over 8 years now, usedvetequipment.com has been helping vets buy and sell used equipment. Save money when you buy used equipment, everything from cages, kennels, pumps, x-ray equipment, lasers, ultrasounds, dental equipment, surgery equipment, lab equipment from Abaxis, IDEX, and Heska, tables, tubs, and sinks. If you have anything you're looking to sell, head on over to usedvetequipment.com, where they bring the buyer and seller together. Or if you're looking to buy some new veterinary equipment, you can check out newvetequipment.com, where they show you the price up front. They have digital x-ray equipment, dental x-ray equipment, ultrasound equipment, LED surgery lighting, surgery tables, full-size autoclaves. When you go to newvetequipment.com, you'll clearly see the price on every item for sale, and you'll also be able to check out the warranty so you can buy without regret. At newvetequipment.com, they show you the price and give you a great warranty. All right, so today's episode, we have Dr. Brett Beckman. Dr. Beckman is a board-certified veterinary dental specialist, and he offers live and online dentistry training courses, and he currently sees patients in Orlando and Atlanta. And along with being a well-renowned international speaker, he is also the founder of the International Veterinary Dentistry Institute, that's IVDI, and the Veterinary Dentistry Mastermind. IVDI is an ongoing project that provides training and assessments to veterinarians to ensure that they're capable of providing top-quality oral care to their patients to earn the VDP title. Through IVDI and VDP program, veterinarians can now master the knowledge and skills required to be considered among the best general practices in the world in dentistry and oral surgery. So I'm very excited to be speaking with him. It's dental month right now, which means everybody's really excited about dentistry and doing dental procedures. But I think one thing, with your dental practice in your general practice is that we should try to figure out how to make every single month dental month for your veterinary practice, not just the month of February. So I think that we cover a lot of really, really good things in this episode that are going to help you to find the right kinds of patients and how to service those patients better. So I'm very excited for you to hear this. If you have any questions, be sure to listen all the way through. I'll give you the links to everything that we discuss here at the end when we wrap up. On today's podcast, we have Dr. Brett Beckman, boarded dentist and just the world's best dentistry training professional in the veterinary industry, in my opinion. And I really appreciate you taking the time for jumping on to this episode with me, Brett. I really appreciate it.
Oh, thanks, Brandon. Thanks for the kind words. I appreciate that.
Well, I'm really excited to have you on the podcast. I think there's just a lot that we're going to be able to talk about today. But before we kind of start, I've always kind of been interested. What got you into training the general practitioners in dentistry? Maybe tell me a little bit of that backstory, because I don't think we've ever actually gone into it.
Yeah, that's a great question, and I don't share that very often. It's kind of an emotional story, but I was a specialist for several years and working at Georgia veterinary specialists, and a very nice lady who I can't really name brought in her two beautiful Irish setters. And I was doing an examination on the first because they had had a procedure at another practice, and neither were doing very well, one worse than the other, and there was a horrible odor in one of the dog's mouths. And I lifted the lip, and there was nothing but recession of the gum, exposing the necrotic bone underneath the gum. And long story short, and after radiographs and evaluation, both of those patients had undergone gingival hyperplasia excision, which was used with a Surgitron, an Eldman Surgitron, on the wrong settings, and literally burnt the teeth and burnt the surrounding tissue, where extractions had to be done in almost all instances in all four quadrants with both patients who were brothers. So at that point, that was just such a traumatic thing for me and her especially, and certainly mostly the patients. And I swore that my mission from that point on was going to be to make sure that that happened without that frequency that existed back then, no matter what I had to do to train veterinarians to get them over time to the point that they knew how to not only diagnose but also treat the patient correctly, and certainly avoid that type of mishap, which was just so dramatic. It changed my career. And so most of my time is spent teaching. I'm in surgery 7 days a month. The rest of the time is teaching and helping veterinarians and technicians, veterinarian and technician teams, to be better at dentistry in their general practices.
That's really amazing, and I think that especially before, having worked with you and knowing about the lack of training that is given in veterinary school and the huge problem that exists there, I was actually really shocked to find out that dentistry wasn't taught just as a consumer, because when you go to a veterinarian, you assume that they know how to do everything, and I think that's generally how consumers view veterinary professionals, is that when they go there for dentistry procedures, they expect that you learned everything that you would possibly need to know. And so it was pretty shocking to find out that the training just is not there in veterinary school. And so I think that this, as far as dentistry goes in veterinary practice, I think there's a huge opportunity for the general practitioner to really stand out for their clients. So can you tell me a little bit about, I think, when it comes to dentistry, what are the biggest kind of opportunities that you can see when it comes to, marketing your practice and really standing out aside from everybody else with your current clients when it comes to general practice versus being a specialist?
Yeah, that's an excellent question, Brandon. I think we have to, as general practitioners, look back at what the dynamics are in practice, because a lot of the pushback from the practice manager or the practice owner is that our clients won't opt for this type of care. So in order to provide the basics of quality dentistry in a veterinary practice today, we need to, as practitioners, have a really good understanding of veterinary radiographic interpretation. Technicians need to be able to take radiographs quickly and efficiently. And you, as a general practitioner, the doctor, needs to be able to interpret those radiographs quickly and make treatment decisions immediately and then proceed to the procedure. And in order to do that, training is required, and it's not like going to a conference here and there and getting piecemeal lectures or labs that are not specifically for the things that we do mostly, which is surgical extractions for our patients with periodontal disease. And at the same time, we because of that training being extended and longer than just a one-off here and there in order to get good, it also is more expensive to provide that service. So when you're looking at practice dynamics and listen to the marketing folks that have been teaching marketing at these conferences for years and in the magazines that we get as professionals, they refer to the 80-20 principle, where 20% of your clients are responsible for 80% of your revenue. And that's exactly what occurs, and that's the solution to that question that the practitioner that's an owner and the practice manager have. Well, our clients won't afford that or won't go for that. They can't afford that. They're speaking for that 80%. The 20% are the ones that are going to meet you at midnight on New Year's Eve for a dentistry cleaning and assessment and be early. So that's your A clients. Those are the ones that you're going to lose if you don't hop on this bandwagon and train staff from a veterinary and a technician standpoint to be able to provide that quality care. And if you don't take that into consideration, others around you are, and we are at the forefront of training the others. So if you are where you want to serve that 80%, which is responsible for probably 100% of your headaches in your practice, then that's certainly your decision. But dentistry is the way, as Brandon had mentioned, to really step up and differentiate your practice from other practices. One additional point to that is a case study of one of our International Veterinary Dentistry Institute veterinary dental practitioners who recently became a dental practitioner by passing all the assessments and becoming one of just a handful in the world to have that designation. And when he started the program, before he got dental radiography and got efficient at surgical extractions, and before he could read radiographs and go straight into that treatment and have a technician that could provide that quick x-ray capability, he was doing about $400 to $600 a month, a procedure for all of his dentistry procedures. So that was his average revenue. Once he completed the program, his average revenue went up for each procedure from $400 to $600 to $1,400 to $1,600, and that's over a 4-year period of learning and applying everything he learned without being in a structured program, with learning from our resources and visiting our wet labs and applying everything he learned. So that just gives you an idea of what that 20% of clientele is willing to do and willing to forego and expect you to provide at this point in your practice if you are a quality veterinary practice in general.
Definitely, that makes a lot of sense. And I think, too, if you're doing any kind of advertising for your practice, I mean, people are searching every single day for veterinary canine extraction practice. And, I mean, people are searching for dentistry terms on the internet. And I think, too, if you're going to be attracting these high-level clients that really want to provide great care for their pet, I think dentistry is probably a very good kind of indicator that if they're looking and searching for dentistry care for their pet, there's a huge opportunity to become that person who is going to then be the veterinarian for their all of the other services that they need as well. So that's a really good and interesting point, and I didn't think about that. And especially now where practices are either, I think there's really only two cases where you have practices that are just booked for weeks, and so much so that they're probably not even taking on new clients. And then it seems like there's only two. They got everybody that's really, really booked and really busy, or practices that are new and starting off and trying to take some new clients and bring on some new clients and things like that. And so if we have a practice that's really busy, and right now it's actually dental month, so it's super timely. And I know that a lot of practices are still doing dental month promotions. How do we make, why should a general practice actually care about dentistry right now when, things are so busy as it is, and they can't necessarily fit any more in? Do you have any kind of thoughts on that? And obviously the higher transaction is going to be very helpful. But why do you think veterinary practices should care about dentistry even when they're so busy and, they're just booked out the door, lines out the door type of a thing?
Yeah, great question. And when you look at the dynamics in the practice, if you are getting phone calls every day for price shopping, generally is what people think that is happening, is people are calling for price, and a lot of the people that ask for price ask for a common thing that they have every year, and that is a dentistry cleaning. And so you get a lot of calls for that, but with that clientele, if they're the clientele that really care about choosing a quality practice and making your practice their home for the life of their pet and their pets, and they're one of those A clients in that 20%, those are the people that you should be answering questions to. That's your target audience, answering the questions as if you're talking to your ideal client. So if that client to be, or potential client, calls the office and a receptionist answers their question about what do you charge for dentistry with a number, and cannot answer any questions about anesthesia, any questions about the procedure itself, and really answer that question as if that was the most important client in the world that was calling on that phone and asking about that service, she's not going to be qualified to answer those questions in all likelihood. So if in order to filter out those rabies only and vaccine only people that are not going to build your practice long term, that have minimal lifetime value, that are most likely to switch at will and change to another practice, then you should designate the person who knows most about dentistry that is not you, the veterinarian, to answer those questions. And who is that person in your practice? You have to ask yourself that question. The ideal person is the veterinary technician that's handling all of those cases. So just think about the impact that a good technician that does, and when I say veterinary technician, I don't mean a VTS certified technician specialist, which is ideal, but there's not a lot of them around. There are definitely less than 100 that are in the world right now. But your technician that is, number one, articulate, that is good at talking to clients, your technician that is willing or has been trained to do veterinary dental radiography series, full mouth series on your dogs and cats, and that knows not just how to handle the day-to-day and the patient care with dentistry and be able to clean and probe and all of those things. They also need to be able to read radiographs, ideally, so that they can do the discharges with that client who is the A client. In that, as a veterinarian, you really need to be doing high-impact work and not discharging patients, and letting that be something that the team does. And the best person to do that on the team is the person that had the first contact with that client, which is if they called, if you have that technician, that she's the one that answers the question. The receptionist will get her on the phone as a authority in dentistry in your practice, so that creates immediate authority with her. So I'm backing up a little bit. Sorry about that. But if you're back on that phone call, that technician-client interaction, they learn to be comfortable with that client. And the client learns to be comfortable with the technician. So when that client comes in and that client goes in the exam room, guess who's the first person that walks in that exam room? Hi, I'm Annie. I talked to you on the phone about dentistry. Do you have any other questions? And then once that client complies with the recommendation to have the oral assessment and cleaning, which includes full mouth x-rays, then those x-ray results and the estimate are delivered by, guess who? The technician that she's already talked to twice. And guess what that means? That means she knows that person. The technician can answer any question she has about that estimate or that procedure. And what do you think your compliance is going to be versus a receptionist giving them a number over the phone that client has not really talked to or bonded with prior to that. So just a tremendous leverage that you can use in your practice to get those good clients and filter out those ones that are on that 80% echelon, and thinking long term that client, not only for that high-end service of dentistry, but also for any high-end service that's provided by your practice, be it ultrasound or intense diagnostic workups for different problems. Maybe you do orthopedics, maybe you do advanced surgery. Whatever that is in that pet's life and in the pet's lives of that owner or pet parent, those procedures over the lifetime value of those good clients just exponentially takes your practice to another level. And that's what I would suggest that you concentrate on in all of your marketing, whether it be voice to voice or whether it be website to the pet parent, or whether it be Facebook groups or pages or whatever you do, email, all of that should be directed at that person. And I know Brandon teaches all this. Brandon's the most knowledgeable and has applied more of this to veterinary practices than anybody in the world, and he's been doing this podcast forever. So he's the guy when it comes to this. So I'm just kind of telling you what he talks about, but though I think those are really important points.
Well, I think that those are really great points. And if you don't know what goes into a procedure, and clients have no idea what goes into a procedure, and I mean, clients don't understand why you even need anesthesia probably a lot of times, right? And so if you're unable to understand what goes into all of your dental procedures, then I think you're going to have a hard time conveying that value. And so I think that that's probably just one of the best pieces of advice, is to have somebody who's trained well and understands everything that goes into it, so that they can build rapport and help to close the sale in a way that doesn't make anybody feel like they're not getting a great deal and a great value. Because if they don't feel like they're getting great value, they just don't understand all the care that goes into the procedures, I'm sure. So along with that, it's a little bit hard for general practitioners to stand out in veterinary dentistry. And I know that there are very specific rules that come to advertising for things. Can you tell me a little bit about IVDI and the VDP program, why you created it, and really what the goal of that is to help veterinarians, stand out and increase their confidence and abilities and things like that?
Absolutely. Brandon, thanks for asking. And that has evolved over time with the origins back to that experience that I had with those two Irish setters. And we have really, in the last 2 years, gotten the veterinary dental practitioner program that you mentioned up and running, and we've had a lot of input and a lot of additions to that program, which was really good at the start. but with the input of our practitioners and the input of my other instructors and all of our collaboration on multiple levels, we've got this down to an art and a science. And to just not to bore the listeners, but I want to just give you a real quick overview. So this International Veterinary Dentistry Institute is an institute that I founded 3 years ago, and the veterinary dental practitioner program grew out of that, where we provide training for veterinarians and their technician team over an 8-month period that is all virtual. So you never have to go and attend a live event, although we are doing live wet labs with the pandemic pending. And we actually did 2 with all of the CDC guidelines imposed on in October and in November of last year in Phoenix and Orlando, which were extremely successful. And we're again in March of this year starting our live wet lab. So you, as part of the program, you do not have to be involved with the live wet labs. We've made some special considerations to make it such that even the assessments that we give at the end, part of which is an assessment on your procedures with you doing them in your hospital, we've made concessions so that actually can happen, and that actually is proving to be better than what we have done in the past with our live assessments with the procedures. So we're so excited about that, and the program is structured so that you're not getting things piecemeal, like trying to read dentistry books, which are, in my opinion, the worst way to learn a procedure. And I, just stepping back a little bit, when I got out of veterinary school, and this may be the case with a lot of you as well, when I got out of veterinary school, we didn't get a lot of general surgery. So we had a general surgery book or 2, and when a condition would come in, we could surely diagnose it, but the question was, could we do the surgery to make it happen? Well, back then, there weren't specialists available anywhere, readily available. So we had to either let that patient go on with the affliction or maybe die because of it, or we had to learn really quick how to do that procedure. And looking at text and then looking at a couple of poor images is a really bad way to learn any kind of surgery, let alone dentistry. So you can learn from books, but it's a very poor media. You can go to conferences, either virtual or live, and get wet lab exposure there, which is generally pretty scant as far as concentrating on the things that we really want to teach. And again, surgical extractions is what I'm referring to. And then also the option would be to do that lecture format in piecemeal at those meetings, live or virtual. And to me, those are terrible ways to learn. So what we've done is we put together a structured program. We have 51 hours of race accredited CE that is the basis for the online assessment that teaches you all of the ins and outs of dentistry from a knowledge-based standpoint, and then that assessment assesses that in a case format where you're given radiographs or you're given images of pathology, and then you're taking a multiple choice assessment to determine your next step. And then the final assessment, all of which is done in your hospital, is that procedural assessment where we're actually watching you do those procedures on surgical extractions. And then once that has been passed, then you have really earned the spot in being one of the best in the world in general practice because of going through all that 8 months of training, which is super doable even if you are a mom that has, and you guys are amazing. There's a vet dentistry moms group, and they call themselves the dentistry nerds. And I think there's over 1,000 moms in that group. And just a shout out to them, because a lot of them are involved in the program, and a couple of them are actually veterinary dental practitioners that have gone through the program. But even if you're that busy, they are a great example that can be done in any capacity with all they have on their plates. So sorry to ramble on there about the program, but I think you can tell I'm really excited about it. It's really made a huge difference in the lives of the patients, in the quality of life of the individual, the lifestyle of the individual, where now dentistry is easy, it's streamlined, it's not stressful like it used to be, and they are among the best in the world in general practice that are not specialists. And I must mention that these are not specialists in veterinary dentistry. These are people that I and my other veterinary dental practitioners who have passed have trained and continually train through mentorship and Facebook groups and meetings live every month in order to not only get them to the point where they are very well versed in dentistry, but also to maintain that mentorship beyond that program indefinitely for life, as long as I can hang around. This is a 25-year program for me. And I've got people in place who are going to take it over if I happen to kick off a little early in 25 years. So everything's in place for that to happen if indeed there's some reason that I can't continue on. But I'm not the program. The program is you. The program is you guys, and that's what it's all based on, and that's what we're there for, is to get you comfortable, get your practice where you can use that name to market, to let the general population of pet parents know that you're a step above most of the other general practices. And when I say a step, I mean a huge bunch of steps above most of the other general practices in dentistry. And you can use that to market yourself, to show the world that you're even better than you were before. And many of the people that were in the program did have a pretty good level of knowledge and skill before they got in, but now they've just taken it to the ultimate level and are just doing amazing things. And along the lines of one of your earlier questions, Brandon, that I don't know if I answered quite well, was how can you put yourself above the general practitioner that doesn't know dentistry. And I can't tell you how important that is to get the word out that you are at that level, because we see on a referral basis in our specialty practice just a lot of nightmares that either went too long and didn't get the proper care because the veterinarian did not know what pathology was responsible for the problem, and the other scope, or the other end of the scope of that spectrum, is where there was harm done, when the treatment wasn't the correct treatment and it ended up causing harm to the patient and harm to the client as well. So that's a huge point in why you should be thinking along those lines, is the patient is ultimately the one that benefits. And we go a step further. After the veterinary dental practitioners out of that program, we create social media and website assets for them so that they can market themselves on social and market themselves on their website. So I create a video just for that person, one-on-one, for them to put up on their media or their websites, or however, email out to the clients that says, hey, this congratulations to Jody Reed. She's just became one of the few people in the world that is a veterinary dental practitioner. She's been through that assessment and training. And so we welcome her to our group, and we're so happy for her patients.
Definitely.
So just some examples of what we do to help that marketing effort. And I just think that's incredibly huge to have a third party that's talking about the person that's gotten through the program and how much that means to their patients and how much that means to the whole practice evolution and the practice of veterinary dentistry worldwide.
Definitely. That makes a lot of sense. And I think it's just incredibly important to, I guess, approach that with the method that you've developed and things. Because there's a book that's called You Can't Learn How to Ride a Bike from watching a seminar, or I can't remember, it's something like that, right? And there's so many things that you cannot learn how to do just by reading about it. And so for things like marketing, I know that that's 100% true, where you're not going to learn what works and what doesn't until you actually try it. But the stakes are that you'll probably just have a post that nobody sees if you are bad at marketing. But if you're bad at dentistry, the potential for harm is massive. And so I think as much as it is important to provide a good standard of care, the alternative is if you're not providing that and something goes wrong, you'll have the opposite of an advocate where, you could have tremendous damage done to your practice through negative reviews and, the stigma of being classified as somebody who doesn't know what they're doing and is dangerous. And so I think that it just is incredibly important from a marketing standpoint to have the skill set and the tools, and your team have the skill set and tools for all the reasons that you just mentioned. So I think that's really cool. And one thing too, that it's just difficult to stand out and difficult to differentiate yourself unless you're, have done a tremendous amount of, maybe you're going to start a specialty practice or something where you're a boarded specialist. And so for the general practitioner, I think it's just a fantastic opportunity. And I know that you have openings a couple times a year for the veterinary dental practitioner program. How would somebody, and we can absolutely link this, we'll probably create a link if you go to veterinarymarketingpodcast.com/VDP. But can you tell us about what the process looks like? Do you have requirements for people as far as, you want to make sure it's a good fit and things like that? Or who would you suggest checking it out if they're interested in it?
Yeah, thanks for asking that, Brandon. IVDI.org is an easy place to go. We have live chat manned most of the week from 8 a.m. to 6 p.m. and many times even on the weekends at night, because I have people that work sometimes close to 24 hours a day on my team, off and on. So you can get help directly there. If you know that that's something that you want to do, you can go on a live chat and say, I heard Dr. Brett on Brandon's Veterinary Marketing Podcast, and I want to learn more about it directly from him. And we'll have a little meeting, a little Zoom meeting maybe here in the next couple weeks, and you can join me on that, and we'll discuss it. What I do need to say is this is not for everybody. This is for the people who can make the monetary investment, which is several $1,000s, as well as the time commitment and attempt to get that training done in that 8-month time frame. And it's not that it's specific, and it's that regimented and that staunch. We do have a lot of leeway on how you go through the program. You can kind of do it as you wish if you like, but we also give you a couple extra months. So you have a year to get through the program with the initial upfront investment. And then after that, there's a monthly to stay in if you don't get the program done in that time frame, which is fine, and some people do that. But the thing about this is, if you go back to what I said about Kevin Smith's practice and the time that he put in, which is way more than the time that you need to put in, he just did it slower over a period of time before we had this program available. He came in at the end and joined the program kind of at the end of his training. But to be able to generate as a practice owner that $1,000 extra per procedure, and or the associate that is generating that amount per procedure and earning it Not that you're charging more just because you want to charge more because of that moniker, but you've earned it because it's going to take you a long time to do that quality work on that individual patient. But knowing that that's the case per dentistry procedure over even a month, if you're doing a couple a week, would more than pay for the procedure once you get those skills, or more than pay for the investment once you get those skills down and you are applying everything that you're learning. And certainly, if we give you that VDP moniker, you can bet you've earned it, because those exams or those assessments are not easy by any means. So it's not for everybody, and it is an investment. You have to look at it as an investment. It's not a cost. It's more of an investment in your time and in your resources. And one of the really impactful answers to questions that I've ever heard was from Warren Buffett, who's the fifth richest man in the world and the best investor that ever walked on this planet. And when he was asked what is the best investment that he's ever made, his answer is an investment in myself. And that's what we have to keep in mind when we're thinking about doing something for our patients, especially, but also for us personally and professionally for the rest of our careers, not just for a couple months, but for the rest of our careers, what that can mean in lifestyle, and especially what it can mean for all those patients that you're helping over time. Definitely.
And I'm sure that would be a great way to invest in your team as well, as far as having, that's a great way to differentiate your practice when it comes to recruiting. If you can give your associates the tools that they need so that they don't feel like they have to be terrified every time a patient walks in that needs dental work. And if they dread it and they hate it, and which is a lot of people don't like doing procedures that they don't feel comfortable with. So I think that's a really, really good point and a great idea. So thank you so much for your time today, Brett. I really appreciate it. And if anybody has any questions, all of the links to IVDI and all of the other courses and things will also be at Veterinary Marketing Podcast. And so we'll be sure to put all of those on there as well. But thank you so much, Brett. I really appreciate it.
Perfect, Brandon. Thanks for having me.
Thank you. All right, so I hope that you enjoyed this episode. Dr. Beckman has a training coming up here for his IVDI program. If you go to veterinarymarketingpodcast.com/IVDI, that link will forward to his training landing page. You can register. He's got a training coming up here in about 3 weeks. If you're listening to this in the future, I'll make sure that redirects to his IVDI programs. But Dr. Beckman is an amazing, amazing educator, and so I really, really suggest that you go out and you check out his content and his info. So I appreciate you listening. If you have any questions, don't hesitate to reach out, and I'll see you on the next episode. Have a great one, everybody. Bye.